Right now, opioid epidemic crisis. We're taking a look at new stats from a Princeton study, and it estimates like in the next 10 years, 650,000 people could die of overdoses from prescription medication. So not things, that people are getting off the street or anything like that. So Dr. Matthew Crooks is here. And first of all, I'm going to ask you, because when we hear the word opioid, we're thinking of like maybe opium or something strange. But so let's talk about what an opioid is.
These are actually prescription painkillers, so narcotics that you may get for pain management from a physician. Anything from a Percocet to a hydrocodone to a tramadol. Those are from a more severe medication to a milder one, but they're all in the range of opiates.
Okay.
And they can be addictive, they can cause secondary problems in addition to managing your pain.
So let's talk about, obviously we know when people are in pain, they are in pain. You have a back problem or some sort of injury. So the pain is there, but you're talking about managing it without these medications. So what's your thought?
Right, what we're seeing in the evolution of pain management is that these medications may be appropriate for really short-term or acute pain, so a fracture or a post-surgery in the range of a few days to maybe a week or so.
Okay.
Beyond that, you start to get tolerance to the medication, you start to see more prevalent side effects. You can actually become dependent on the medications and have something that we call hyperalgesia, which means that you perceive the pain to be even more severe than it is when you are on the medications. So we start to look now at more of a diagnosis of the pain generator and actually focusing on targeting the root cause of the pain and managing it by actually treating the problem rather just by covering up the symptoms.
Okay, because the pain is the symptom, right?
Absolutely.
Especially when you're talking about chronic pain. So what are some of the philosophies you have to kind of avoid the pain med route?
So a really accurate diagnosis and a very targeted addressing of the problem. Usually what we do is, for chronic pain, we'll actually go down right to the nerve root level to identify the single nerve that's causing the problem. And you can identify that and then target that with a very targeted injection, a minimally invasive injection that can calm down the nerve, calm down the inflammation, and even deaden the nerve.
And we're looking at an x-ray here, so tell me what we're looking at.
So this is actually a cervical spine or a neck. It's the bones, joints, and the disc spaces of the spine. And you can see coming off to the side there, that black area is contrast dye. And farther to the side, that very thin line is a needle. So what we do is we'll place a needle right at the area where that nerve comes out of the spine, not into the spine itself, but catch that nerve right as it comes out where it's pinched, causing like sort of a stinger type of sensation down the arm. And what we'll do is put a little bit of local anesthetic or numbing medicine and some cortisone to calm down that nerve and take care of the pain for weeks or even months.
Because do you agree, really, the problem that people are looking to avoid is they don't want to feel the pain anymore. So if you're treating what's causing the pain, then there's no need to start dealing with things to help the symptoms so you're not feeling it.
Absolutely. You're actually going after the underlying problem and then rehabbing it and preventing it from coming back.
Okay, thank you so much. Again, that's Dr. Crooks, and you're at Pinnacle Pain and Spine.
That's right.
So if you wanted to find out more information, because obviously you tailor it towards each person and each injury.
Most definitely.
Yeah. Okay, thanks so much. Appreciate it.
Nice to see you.
All right.